Hello friends, I am Dr. Goel. I head the Department of Surgical Gastro-Onco and Advanced Laparoscopic Surgery at Max BLK, Pusa Road, New Delhi. We are a teaching department. We are 3 consultants, senior consultants working together as friends. Friends, let's talk about how can we treat colon cancer. First of all, let me say that colon cancer is a highly curable disease if diagnosed early. When I say early, it means stage 1, stage 2. Stage 1 and stage 2 colon cancer can be curable up to 95%, which is a huge percentage. There is a hope for the patient. Cancer does not necessarily mean that the life ends. Especially colon cancer, as I said, stage 1 and stage 2 can be cured up to 95%. Stage 1 and stage 2, the treatment is surgery. Surgery means we remove that portion of the large intestine which is harboring tumor and rejoin small intestine to that portion of the colon which is remaining. While we are removing the portion of the colon which is harboring cancer, we also have to remove the lymph node which are in the surrounding area. All these lymph nodes are along the blood vessels. So one has to be very careful that without injuring the blood vessel, without causing harm to the blood vessel, we need to remove all the lymphatic tissue, all the fat around the lymph nodes along with the segment of the large intestine which is having cancer. That is the trick of the surgery. Now this surgery can be done by conventional method. That means we give a cut from top to bottom, which used to be done in the older days, or we can do this by minimal invasive technique. When I say minimal invasive technique, there are 2 ways. One is laparoscopy and second is robotic. Today most of our surgeries we try to do robotically because there is a precision, there is a 3D vision and there is a ease of doing an operation for surgeon, which results in beneficial effect to the patient in terms of removal of the lymph node, in terms of lesser pain, in terms of lesser bleeding, in terms of early recovery for the patient, in terms of patient going back to work early. Also if patient has to be given chemotherapy after the surgery, it can be started much earlier as compared to conventional surgery. Since there is no big wound, the chances of wound infection are almost negligible, which is again a very good sign, because once you have a wound infection in conventional surgery, what actually happens that you require daily dressings for weeks, and then you can develop hernia which will require another surgery. These are all possibilities which are likely to happen after conventional surgery. But by minimal invasive surgery, all these problems can be avoided to larger extent. Once we have done the surgery and we have sent our specimen for histopathology, our histopathologist will do many sections of our specimen and put them to test, spatial staining and looking under microscope. And after they do that, they will tell us the type of the tumor, they will tell us the staging of the tumor, they will tell us whether the tumor is spread to lymph nodes, lymphatics, nerves. All this information we will get, whether the margins which we have cut are free of tumor or not. These are all very important information for us to know to plan our treatment further. If the specimen examination report comes out to be stage 3, stage 4, then we probably would like to discuss this case in our tumor board and decide further course of action. Most of the times chemotherapy and or immunotherapy is required for these kind of patient. And if it is stage 1, 2 tumor, then probably no adjuvant treatment or no additional treatment is most of the times required.